So today we'll be discussing qualitative data, which is analysis of qualitative data. So in terms of qualitative data analysis, I think they are one of the issues which you need to understand in terms of how do you collect qualitative data. Qualitative data, as we explained in the previous lectures, you usually, when you're collecting qualitative data, you get it through open-ended questions. These are questions where, whoever you're asking your research participants, they are free to say whatever they are supposed to, they are saying pertaining the issue which you'll be asking. Because of that, the answers are not predefined. It is very difficult to take notes during the process. So the best option now is to record. So in most cases, if you are doing qualitative research, you need to have a recorder which you can use to record the conversation, because it will be difficult for you to, you're asking someone questions which are open-ended. It will be difficult to really write everything what they are saying. So the best thing is to record. These days, most of the recording can be done using a mobile phone. You can actually use your mobile phone to record. Most of these smartphones, they can record very good recordings. But before you record someone when you're doing qualitative data, you need to seek permission and consent from that individual. You can't just start recording someone. So before you, if you're doing qualitative research and you want to record your participants, you need to first seek permission to record before consent and permission to record. It is very important to seek permission and consent. But as you seek permission and consent, usually we don't recommend to include personal identification data in the recording. When you are discussing with your client, you're seeking consent, maybe you're still in the preliminary stages where you're discussing maybe their name. So some of the issues which can identify the patient. You don't need to record that, and you don't need to record that information. You only need to record when you start asking questions. That's when you record. So you don't record personal information or identification data when you are recording someone. Remember, there's a danger. The recording can be lost, and if the recording is lost, there's issues to do with privacy and confidentiality. So after you've collected your data, and as I said, it will be recorded. The next thing now is to now analyze your data. How do you analyze your data? There are steps which you need to follow. The first step is to prepare and organize your data. How do you do this? As part of the preparation of your data, you need to first transcribe your data. By transcribe or transcription, it means we are converting the recorded audio into a written speech. You have to, after you collect your data, you then have to sit down. You start listening to your audio and converting whatever has been said into a written speech. And this written speech, usually we recommend what we call verbatim. Verbatim, it just means as it is. You don't have to change anything. You don't have to summarize. And you don't have to summarize whatever the person was saying. So it means you are saying word by word what they were saying when you were answering when they were answering the questions which you were asking them. So that's the first step, where you need to transcribe. That is converting the recorded audio into a written speech, verbatim. And by verbatim, it means you're transcribing everything word by word. Then after you have converted your audio into a written speech by verbatim, you then print out your transcript, and you print out your transcript. So those verbatim, those written speech in qualitative research, we call them what? Transcript. At times, you might use other things on top of your transcription. Maybe you've got some notes, other documents, or other materials which you used as part of your qualitative research. You might also need to have all those to support your transcript. As part of yes, as you'll be asking your study participants and recording most of the information, you can also take notes and also do some observations. Some of those things you can take notes, but the main way to collect the data will be the recording. Usually, before you start collecting your data for every transcript, for every sub-study participant, it is always wise. It's recommended, actually not wise, to always put demographics of whoever you're collecting, their age, their sex, maybe their marital status, or any information which might be, like in this case, we are using an example of quarantine, which we've been using for this exercise. Maybe you need country of origin. You need country of origin. Yeah, maybe whatever information which you need. So this one you record it, separately. You record it separately. As I said before, you start your recording. You need to discuss all these issues above: issues of consent, issues of permission. You get the age, you get the sex, you get marital status. Then when you start asking your questions, that's when you start recording, and you don't include this identification information in your recording. So this information, you will need it because it will also assist you to analyze your data. Then the next stage now, after the first stage, you then review and explore your data. By review and explore your data, it means you have to read your data. You remember, now this is now written now. You have now converted your audio speeches into written speeches. It means you have to read this data maybe for several times for you to understand it. So if you don't read it several times, it will be difficult for you to really understand. By reading it several times, it enables you to understand the sense of what it contains. You might need to keep notes about it. As you read, you need to keep notes about the information, ideas, or questions which you might have as you read. So you need to read several times and explore the data for several times. So it depends. That's why I always say, maybe on the first stage, that's why I always say, for qualitative data, you don't need to have so many study participants. Because if you have a lot of study participants, it means you have to convert their speeches into written, into transcript. And they've got 10, 15 participants. That's a lot of work. Usually, to summarize a speech, a 1 hour speech, if you had to convert a 1 hour speech into a written speech, it can take close to 10, 12 pages. So it's not easy to do qualitative research. That's why we don't recommend you to do a lot of study participants, because converting the speech into written is a bit complex. And in terms of number of participants for qualitative, we don't recommend a sample size to say how many participants I need to ask. Usually you start the participants I missed this. This is very important. You start the participants for your qualitative. They're determined by what we call saturation. By saturation, it means you are no longer getting any new information. You're asking people, but they're telling you the same. You ask the first, for example, we are discussing about quarantine centers. We are getting same information. So when you reach saturation, it means that's usually when you stop for qualitative. By the times it might take a lot of study participants for you to reach saturation. Sorry for that divergence. Then as you read your data now, you read it, you need to be creating codes. You need to be creating what codes in this data. As you are reading, remember you have printed the transcript, and you are reading. How do you create these codes? You can use highlighters, you can write notes in the margins, you can use stickers, you can use concept maps, or anything that might help you to identify your data as you are reading. You can highlight keywords, you can highlight phrases, and you can highlight phrases as well as make notes as you do that. So as you read now, remember, you read it to try to understand your data, but as you read it several times, several times, you then try to really highlight some of the key issues as you are reading your data, and you can highlight using some of the issues which we discuss. And so you're highlighting keywords, phrases, as well as making notes to categorize the data. Then the next step, usually when you're reading, you in terms of, I think there's the use of the word codes, and there's the use of the word codes. So as you are reading, as you are reading your data, you're going to find phrases, words, or keys which are pointing towards same issues or same issues being raised. Initially, you start but it is small, where you are identifying those codes or those common phrases or whatever the study participants will be saying. As you read, you can combine these codes into themes now. You can combine those codes into themes. So these are like the common issues which are arising. Like in our example, we should be using to illustrate this. We want to identify factors which might be contributing to patients in quarantine centers getting infected with COVID-19. So as you read, you need to initially, you might see, you might need to start small, right, where you're looking at keywords and phrases. But as you read further, you need you have codes. You have codes. Those codes you can then revise and combine them into themes. Then as you do that, you need to then to identify what are the recurring themes: language, opinions, or beliefs. Remember what I said here. Good for qualitative data. For qualitative data, in terms of study participants, these are determined by saturation. By saturation, we say it means you no longer be getting any new information. And for you to be able to pick these recurring themes, language or beliefs or whatever, it means as you analyze your data, as you read into your data, usually what can is it's one of the keywords which is you have what you call an iterative process, and you are going back and forth. Iterative, iterative, and I'm trying to get the correct iterative process, and which means you are going back and forth. You are going back and forth. You are going back and forth, looking into your data, and you. Because for you now to pick these recurring themes, language, opinions, or beliefs, you have to make sure what you're doing is an iterative process, and this is where you go back and forth, reading your article, reading your transcript several times, so that you pick some of these issues. And so as part of that, maybe I'll put these things as They might not be like really like some key concepts, and this is some key concepts in qualitative research, which you need to understand. They are not like part of they're not like really data collection, but they go hand in hand with what with that I'm discussing and teaching. So as I said, you start the participants. How do you do it? And you go back and forth for you to and in that whole process of going back and forth, usually we call it interim analysis. It's just interim analysis. You'll be analyzing your data as you go. As you analyze your data, as you are going back and forth, you're analyzing your data, and as you analyze your data, by doing that process, you'll be able to pick now if you have reached saturation. If you had reached what? If you had reached saturation. Remember, we said by saturation, you no longer be getting any new information. Then the last step, you've been analyzing, you've been doing your iterative process, going back and forth, analyzing data in the process. You have your themes. Then as you get your themes, you then present your themes in a cohesive or a coherent manner. And presenting your themes, this is more of like you'll be presenting your themes. You'll be like writing you're now writing your results, and you're writing your results. You'll be writing your results in a cohesive or coherent manner based on the themes which you have found. So I think in brief, those are the basic steps for qualitative data analysis. So I'll now go to the next stage now, where I'll be using our example. Where I'll be using our example, which we've been working through during this research method, during this research methods lectures. So for that question, for that topic, our research question is: what are the factors that might be contributing to returnees getting infected in COVID-19 in quarantine centers? That's our research question. There's been a lot of stories in Zimbabwe where people in quarantine centers have been publishing their experiences in quarantine centers. I will use one of the stories which was written by a guy called Munyaradzi Madziwa. So this is not my story. I acknowledge this. Really, I got it from Munyaradzi Madziwa. And if you want to get the story is available online via this link where you can read it. So I'm going to use this story, which was written by Munyaradzi, as an example of illustrating lives in quarantine, to illustrate how we do qualitative data analysis. So from this story, let's assume Munyaradzi was asked a question, and the open-ended question which Munyaradzi was asked was, please, can you share your experience in quarantine? That was the question which Munyaradzi was asked by the researcher who was research. So I assume this story, I'm trying to convert it to a research and assume someone asked him this question. Then Munyaradzi responded. So I will read through the first part of the story, and assuming this is how Munyaradzi responded. So I am an inmate. So the story goes, I am an inmate at Blawayo Polytechnic Quarantine Center. I arrived back in Zimbabwe through Victoria Falls on May 14, 2020, and I have gone through a hair-raising experience in 2 of the quarantine centers. I have decided to share this experience in a bid to appeal to authorities to correct the situation in this in a bid to correct the situation in these centers, which is scary and obviously a driver of the exponential growth in COVID cases, which we've started to notice. It is not by coincidence that the latest figures that have pushed Zimbabwe COVID cases 6 times up are coming from quarantine centers. There are lax conditions, and the probability is that many inmates enter these centers without infection and then get it there. My scary story started at the border at Victoria Falls, where a Minister of Health officer demanded US $10 or Zimbabwean dollar equivalent to disinfect my car. He threatened that I either part with that amount or get the car impounded until get the car impounded until after 21 days. I leave that story for another day. I was then admitted at a quarantine center at Mosia Junior Secondary School. I got scarier. I was ushered into a classroom and told to find any space that was free. There were people sleeping on top of desks, some on the floor, and each had a single blanket. I queried to the ushers the rationale of putting me in the same room with 11 people whose places of origin or COVID status I did not know. I got no response. In the end, I retired to my car where I spent the next 4 days sleeping. There was no Minister of Health official to attend to us until midday the following day, and when they came, they were heavily clad in personal protective equipment. They sanitized every step of their way as they came in to test new arrivals. There was a crowd behind me as I approached the health desk to get my initial test. Everyone in the cloud was clamoring to get tested or to get their test results. Some had been in quarantine for 26 days. The majority did not have face masks and there were no sanitizers in the site. So this story, I didn't copy the whole of the story. You can read the story, the rest of the story. You can Google it via internet and you can read the story. So this is the first part of the story. So remember, we are assuming as a researcher, you asked the question, please can you share us your experience in quarantine center? Then the participant responded, and you are recording. Then you you transcribe whatever they were saying into into a transcript, which is this, which I was reading. So you read this transcript several times. After reading this transcript for several times, the next stage which you go, it will be coding now. You need what? You need to start coding. So I have skipped other stages and tried to and maybe now as I'll be reading this and I will then be coding. So I did a bit of the coding. Remember, yeah, I gave an example. How do you code? You code by highlighting. You can make notes, whatever. But for me, I was using colors just to highlight some of the key issues. So this is how I coded. This is how I coded that. So the first paragraph, I didn't find anything interesting. I didn't find anything interesting. So I did not code anything. So I think it was introduced the way he arrived in Zimbabwe. Then the second paragraph, I decided to share. I think he was sharing this was about sharing the experience. This was about sharing the experience and the dangers that if this is not corrected, it can increase. There's a drive of exponential growth in. And in the third paragraph, for me, I thought I find something interesting. It is not by coincidence that the latest figures that have pushed Zimbabwe courses 6 times are coming from quarantine centers. So remember, our research question is, we want to find what are the factors which are contributing to returnees getting infected in quarantine centers. So I thought this one to me is an interesting thing which I thought I would highlight. There are lax conditions and probabilities that many inmates enter the centers without infection and they get it there. So I think this one to me is the lax conditions. As you said, it's one of the things I thought I might need to highlight. Then this one I also thought is interesting. My scary story started at the border at Victoria Falls, where a Minister of Health officer demanded US $10 or the equivalent to disinfect my car. He threatened that I either part with that amount or get the car impounded. So for me, I thought maybe in these whole quarantine centers, there might be this issue, which I thought and that I can highlight also as an issue, where people are forced to pay bribes. Then I thought this one is also interesting to highlight. I was then admitted at the quarantine center. I got scarier. I was ushered into a room and told to find any space that was there. There were people sleeping on top of desks, some on the floor, each with a single blanket. And this is like an interesting experience, which they are saying. From the way the way this is explained, other people were sleeping on top of desks, some on the floor, and they had a single blanket each. I thought it's an interesting thing to color. Then there's this question. I queried the ushers the rationale of putting me in the same room with the 11 people whose places of origin or COVID-19 I did not know. I got no what response. Then I thought this one is also interesting. There was no Minister of Health official to attend to us until midday the following day. Then they finally came, and when they came, there was a crowd behind me as I approached the health desk to get my initial test. Everyone in the crowd was clamoring to get tested or get their results. I thought this is interesting, and which I thought. Then some had been quarantined for 26 days. I thought this is also a code or a theme which is interesting. Then the majority did not have face masks and there was no sanitizers inside. So I was doing this thing a bit gross here. The way I've been coding and identifying themes. You can start. You can start. You can start as I highlighted. You can start by really taking keywords, whatever. But for me, I did it. I kind of it was more gross, where I was taking bigger chunks. So for me, I was putting colors, and there's yellow, blue, green, whatever. So if I was reading this, or remember, as I said, with this story, I only took the first part. If I was reading the whole part, if I see sections which are more or less similar, I'll highlight them with the same color, so that I can pick, and I pick what are the issues which are being raised. So remember, I might have 5 or 10 papers which I'll be getting from different study participants. I will make sure I will highlight those. I'll highlight the same themes, same codes by the same color, so that I'll be able to consolidate information from different participants. So, but remember, this whole process which I'm doing, which I'm coloring by highlighting, there are softwares which can be used to do these processes, where you can upload your transcripts. Then you can highlight several of these transcripts, and you can actually combine some of the information. So if you are interested in this, it's more advanced, but you are free to look around for those softwares. There's Atlas, there's NVivo, and many other softwares which are used for this. But for starters and for beginners, you can actually use you can actually print and you can actually highlight using those basic highlighters on a paper. Me, I'm using a computer, but you can actually do this using highlighters. Then as you read through these things and as you read through your transcript, several of your respondents, you might then need to see, for example, now to pick what are the themes which are emerging from my data as I analyzing. So to me, I thought the first one which I highlighted, the issue of lax conditions, I thought maybe this is poor supervision. It's going to be a theme which is coming from there. Then there was the issue of paying $10 to the Ministry of Health officials. To me, I thought this theme might be corruption. There might be a lot of corruption which is happening in these quarantine centers. Then there was this issue. I was then admitted at quarantine center Mutua Senya, and where I got scary, where I was ushered into a room and where I was told to find any space that was free. I thought this one, some were sleeping on top of desks, some on the floor, and each with a single blanket. This one, it points towards overcrowding and in these quarantine centers. Then there was no Minister of Health official to attend to us until midday the following day. A very clear sign that there is no routine medical follow-up of those in quarantine. So I thought it's also a theme where people are not being followed up. Remember, as I said, for me, our research question is we want to see what are the factors which might be contributing to returnees getting infection in quarantine centers. So it's a clear sign that from this statement, there is no, as a theme, there is no routine medical follow-up. Then everyone in the quarantine center was clamoring to get tested or get their results, which means there were issues and limited access to testing. And people were not actually being tested because of that. And there was also delay of results. Then some had been in quarantine for 26 days. This one is a clear sign that there's overstaying of patients in quarantine centers. Then the majority did not have face masks and there were no sanitizer inside. Another theme which can actually see there's lack of personal protective equipment. So if you read several of these transcripts from your study participants, you'll be able actually to get out what are the main themes which are coming out, which are the returnees, which the returnees are bringing out, which might be actually risk factors for them to get HIV, for them to get infected by COVID. So this would be like your themes. This was a very short paragraph, but from this I've managed to pick a lot of around 7 themes. Let's say with 10 or 15 study participants, you might get more themes. But as you get more themes or codes, you might need to consolidate them or to combine them so that you have fewer themes. Because you don't want, remember, start with codes, themes, but you can actually combine some of those themes so that you don't have a lot of themes. So if you as you have your themes now, the next stage, if you remember where we're discussing, could you now present your themes, writing your results in a cohesive manner? So you can now use your themes now to write your results. So you can put a narrative now. You can put a narrative. So there's let's take for example, overcrowding. So you can actually use overcrowding as a you can actually use overcrowding. You can use overcrowding as a subtopic, and as a as a subtopic for your results when you are now writing your results. It depends how your results are organized. So you can say you're now writing your results, maybe from the study. We noticed whatever we had from the study, several participants, reported overcrowding, and overcrowding, whatever. Several participants reported overcrowding, blah 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 blah. You expand whatever about overcrowding. Then you might then need to give what, for example, and they need to give when you have expanded whatever is finding your owner, and try to to write a bit of narrative about the issue which you are discussing. Then you can say, for example, or I want to put a quote now. And remember, as you are writing qualitative research, you always want to write putting quotes and putting quotes. So, for example, one of the participants reported the following, and reported the following, comma, blah blah blah. You put your things in quotes to support your statements which you are saying. Could you, whatever, from the study, if you realize that there is overcrowding, we ask whatever. For example, one of the participants reported that you then take a quotation, and you can then take a quotation. You can then take the information which was said by one of the study participants. You need to look for good quotations to support your information. So, for example, this is but. So you put it as a quotation in your results. So remember, if you remember the previous lecture where we are discussing about quantitative, you'll be putting numbers, but for qualitative, it's not about numbers. It's about themes which are coming from the data. Then you support your themes with quotations or information which was said by study participants. I hope you also remember when you discussed on top. Sorry, I need to take you back so that you see where we're discussing. We also discussed the issue of collecting age, sex, marital status, and country of origin. As you put your quotes, as you put your quotations in your results, you need to also put, for example, the 34 years female who came from South Africa for your results. Something like that. So that's maybe written from South Africa, which means as you read your quotation, you need to know who said the quotation, maybe their age, their sex, where they were coming from, and something like that, so that your results are what are supported. So you do the same for the other themes. You write, put them in paragraphs, writing the findings and the information which you have received. So I think in brief, just this is the process of qualitative data analysis, where we said in terms of the collection, it's open-ended. You need to record. Before you record, you seek permission. Then these are the steps for analyzing your data. You first transcribe your data. You read it several times to get sense of what it contains. You create codes. From these codes, from these you create codes. From these codes, you review the codes, revise, and combine these codes into themes. And for you to do this, it has to be an iterative process where you go back and forth reading your data several times. As you are reading it, you are analyzing in the process. As you analyze, in terms of study participants, if you're no longer getting new information, which is saturation, it means there's nothing new coming in. You can then stop your research. Then as you do that, after the whole process, you can then write your results, using themes in a cohesive manner. Then I gave you an example of our research question using a story which is available online from one of the person who was in quarantine centers. Our research question was, what are the factors that might contribute to returnees getting infection in quarantine, what centers? You read your story and it first, then the next stage as you are reading your story, you are now coding and identifying themes. After identifying your themes, you list your themes which are coming from your data. And then after listing your themes which are coming out from your data, you can then present your results and writing narrative about of those themes. And to support the information for the themes, you can then put quotations, getting information which was said by your study participants, and you do the rest for the other themes. So yeah, I think this is an introduction of analyzing qualitative data, and I hope this will be useful. This will be useful for you if you decide to do a qualitative research for your project.